wonderful good day to you. This is Owen McCafferty, being brought to you on behalf of the kindness of Professional Fusion. Today we're going to be talking about some issues relating to education that relates to the workforce and the education specifically in the areas of veterinary medicine, dentistry, and dermatology. Of course, the application, I think, could be used in a more expansive basis for discussion of many different professions, including accounting, law, architecture, engineering, any profession where there is a demand for a knowledge base. Basic issues, let's talk about first in terms of education, both of employer and employees. Employers have a good background of what's needed in their profession because they pass an examination of licensure, maybe a series of exams in licensure, accounting to a board, which could hold their license if they don't maintain continuing education. Some professions demand a lot more in continuing education than others. So for example, in accounting, the bare minimum, the absolute bare minimum is 40 hours. And if you're certified in forensics or if you have another area of specialization, as I do as a certified veterinary practice manager, there's separate continuing education that isn't necessarily accredited from that which is valid for a CPA. So in a lot of instances, especially in the area of valuation, forensics, information technology, there's quite a bit of additional coursework that's maintained. So in a profession, you don't just stop at the point that you are licensed. There's a continuation that requires a devotion to the profession. And it goes well above and beyond the absolute minimum that is needed to keep your license. But the educational process is essential. Education is needed because all of the professions are growing as a result of technology by leaps and bounds and require a skill set. In fact, I know of people in many professions that leave the profession early because they're getting a little bit too antsy and possibly scared that they don't know that which they should. So in a profession, you have to be committed to continual education. And that continual education is far greater than just what's stipulated by the specific practice board that governs your activities. Then you have individuals that may not necessarily be part of that practice board, but are governed by that practice board. So for example, in dentistry, you have dental hygienists. In veterinary medicine, you have licensed or certified technicians. Then you have individuals who are in their own separate board and profession. So for example, nurse practitioners in dermatology practices would be an example, whereas a physician's assistant would be part of the medical board. So in those instances, there are quite a bit of continuing education hours that are required, and the demands are as great, if not greater, than being a member in the titled profession that you serve. Now let's go into the area of practice management. Practice managers require continuing education. If you are part of a group such as the Certified Veterinary Practice Managers Association, CVMA, and you have a grant for being recertified every 2 years, you're going to have to take continuing education courses. That also holds true of the Veterinary Practice Management Association of Great Britain and the Republic of Ireland, where there are CVPMs. And as part of that group or that association, if you will, there is recertification requirements. So in pretty much every area of of an entity that serves in a professional manner, either directly as being licensed in that profession or being a critical part of that profession, such as support staff. There are continuing requirements for education. Those educational requirements are the bare minimum. Now let's go into the period of time before you enter a school. And you want to ask yourself, are the folks in your practice educated adequately, sufficiently, and with enough competency that they can deal with the public as a whole? So for example, in the United States or Great Britain or Canada or Australia, have they mastered a derivation of the Queen's English? Or as my own cousins in Ireland, there are certain derivations of English often brought to you by the language difference that existed before. So Irish has a certain terminology and a certain skill set for words and grammar that may bleed into the English language. You have to make sure that whatever country you are working, that you can speak the language of that country. So for example, Australia may have a different process for speaking the Queen's English as would Canada or America. Although Canada and America being part of North America, there's not as much difference, except if you pronounce certain words like process, or you end a sentence with a. In one country, such as Canada, that would be normal. In the United States, it would not. But other than that, the ability to speak clearly and distinctly, to use language and master vocabulary becomes essential. We're finding, though, that many individuals that are brought into professional environments do not have the capacity to speak the language that's required. So, for example, speaking clearly, distinctly, and with the appropriate meter for the age group audience is so important. So, for example, if you're a rapid speaker and you're dealing with an individual that goes into an age group where rapid speaking is misunderstood, you might have difficulty in communicating. There are certain references and words and ways that we all communicate. But education and knowing the differences and really speaking to your audience becomes an essential element. So although there's quite a bit of variances that exist, something as simple as arithmetic is amazing to me that is so difficult to understand. We misuse words. So for example, here in the United States, we use the word do the math, or the phrase do the math. There's no mathematics in quite a bit of the elements that we're speaking. It's all basically simple arithmetic, adding, subtracting, multiplying, and dividing. But we misuse words. Mathematics would be more akin to algebra or trigonometry or geometry. It's not necessarily the adequate utilization of the terminology. So if you hope to be successful in a profession, number one, you have to speak clearly and distinctly. You have to understand the audience with whom you're dealing, and you have to be able to speak in a way that is comprehensible, because ultimately communication has as its basis the ability to speak. You have to be able to learn basic skill sets in arithmetic and to understand literal references in terms of history, sociology, the philosophy and psychology that exists in any culture. Is important that you at least have individuals in your practice with a basic understanding. There's remedial activities too that may be required, but in all of these instances, it's an adventure. So I'd like to say thank you very much. Just a word out there. Thanks for giving me the chance of speaking on an issue that I think is very important. Thank you.